Welcome to Life Choices. Thank you for being here today. I know you're going to be glad that you're here. My special guest today is Dr. Alex Spinoso. And Dr. Alex is an anti-aging specialist, and I'm going to let him tell you what else he does because I'm having a lot of trouble with this word.
Autologous.
Autologous cell therapy.
Yes, ma'am.
Yes. So tell my audience what that means.
So autologous cell therapy is where we take your own stem cells from your bone marrow or your fat, and we can put them into different areas of the body to help, and may help heal those parts of the body up, such as a knee or a shoulder joint or things like that with chronic injuries.
Well, I know when I was having a problem with my knee, everyone said you have to have a knee replacement. And should I tell them about how I met you?
Yeah, absolutely.
And how it came about?
Yeah.
So Dr. Alex had this wonderful little commercial thing on Facebook and said he was going to be doing a lecture on stem cell. And a lot of people had been telling me about stem cell. And I thought, well, I'm going to go and hear him. So I went there and I listened to him, and it sounded really good. But, you know, anytime you do an alternative medicine, you get kind of nervous because you're probably paying out of your own pocket like I was.
Yeah.
And so I'm praying. I'm saying these prayers. Please, God, don't let me spend my money on the wrong thing. This is expensive, but I want to do it. I really think this is a good thing. And a slide came up on the screen in your presentation. A slide popped up about the time I was doing this prayer. And I thought God had answered my prayer because, and let me tell you why, because a couple of years ago when I had cancer, I had done the same thing. I had gone for an alternative medicine, not the traditional medicine that everybody had, and I turned down the chemo and the radiation, and I kept praying that God would send me a sign, send me a sign, send me a sign. I thought I was going to get a dove or a rainbow or something, but instead I got a sign, and it said, the power that made the body heals the body. It is the only way. And I made the decision to go with that doctor at that time. And so then when I was listening to Dr. Spinoso at that lecture, just when I was saying prayers, that same exact sign popped up as a slide on his presentation. It was almost like God hit me on the head and said, how many times do I have to give you this same message, right? And so I'd made an appointment and went in, and I've been glad ever since that I did because, as you all know, I'm walking just fine. Well, most days. Today I fell over furniture, but most days I'm walking really good now, and it's been a wonderful experience working with you.
Well, we're so happy that you chose us.
So how do people make the decision whether to go with the stem cell versus the traditional medicine? What things should they consider?
So usually when we see a patient, they've tried almost everything. They've had cortisone shots, they've had the physical therapy, they've tried the pain medications and things like that. And a lot of times traditional medicine, that's what we're taught, and that's what I was taught through traditional medicine. However, researching it more and going through more fellowships in therapies that can help patients in alternative ways, I've found that there's a lot of other treatments that patients are able to go through and are able to do that actually might help them more than the traditional therapies. So if they've tried everything and it doesn't help, or they're being told there's no other options, or they just have to live with their pain, which is never a good option, just to live with your pain. No. These are therapies that somebody can look into and see if there's a possibility that they can be helped.
Now, you are a medical doctor.
Yes, I'm an MD.
Yes, and you studied in America and you studied in the UK.
Yes, ma'am.
And you have been in 20 different countries practicing your medicine.
Yes, I've traveled all over the world, practiced medicine in a bunch of different countries, almost every continent except for Antarctica. So I've been everywhere.
So you're very experienced.
Yes, ma'am.
But you look very young.
Thank you. Thank you. That's why I grow the beard, to make sure I don't look as young.
Yeah, because I think sometimes, people might look at you because you do look young and think, well, how much would he know? But, I mean, you've worked all over the world.
Yes.
And you're a well-known doctor, and you're very involved in the medical field.
Absolutely, yes.
Yeah, and on the cutting edge of all kinds of new therapies.
Yes, absolutely, yeah. And we're always, on the cutting edge, you always have to make sure that you're always in line with the government regulations and everything like that. So we're always making sure that we are, in line with what the FDA recommends, in line with what the CDC recommends, and just making sure that we keep our patients as safe as possible.
Yes, so besides knees, what do you do?
So we do a bunch of other things as well. We'll do hormone therapies in patients because most of the time after the age of 40, most females and males start to have a problem with their hormones where they decline. Now, you go to a primary care doctor, and I know because I used to be one, they'll say, oh, that's just normal aging. You're supposed to feel like that. But that's not the truth. You don't have to feel that way. We like to, provide hormone therapy so that you feel younger again, so that you reduce your risk of heart disease and cancers and reduce your risks of dementia and other brain-related inflammatory disorders with hormone therapies. We also do quite a bit of weight loss. And I know because of COVID-19, everybody's been sitting at home watching Netflix and snacking all day long. So we help a lot with weight loss. We help a lot with anti-aging, Botox and fillers and aesthetic medicine as well. So we're kind of a one-stop shop for the whole body, taking care of it inside and out.
That's amazing. That's amazing. Well, I know that I have really enjoyed going there and being treated by you, and now I'm on the weight loss program with you, and that's kind of nice because I need to get the weight off the knee. I think sometimes people don't realize that the weight affects the joints to that degree.
Yeah, you're absolutely right. So that's what we do, is make sure we're taking a multidisciplinary approach to somebody who might have a knee problem or a shoulder problem, not just focusing on that part of the body, but making sure the rest of the body is well taken care of and supplemented as well, whether that's certain vitamins or minerals that can help your body heal at the same time, to make sure that, hey, we're not just going to focus on the knee, we're going to focus on your whole body and just make sure that you're taken care of inside and out.
That you become a healthy person overall, right?
Absolutely.
When a person decides to go with a more, what would you say, a more natural medicine or more naturopathic, well, you're not a naturopath,
I'm
though.
not a naturopath,
You're
no.
a medical doctor.
Yes.
But when a person decides not to go with what would normally be the tradition,
yes,
what questions should they ask?
I think the main things that people should ask should be, who have you treated before? And obviously because of HIPAA they can't say people, but the types of people that they've treated. Let's say you came in with a knee issue. Have you treated other people with knee issues? How have they done? Have you treated other people with weight issues, or if they have diabetes or hypertension or a certain disease? Have you treated people like that, and what have been their experiences? And we also hire all of our girls. Sometimes they have different medical issues that they can help speak to the patients about what they've gone through and how they've healed themselves and what has helped them and what hasn't worked for them. That way our staff is highly educated about what the patients are going through as well.
Yes, yes. Your staff is wonderful.
Oh,
I
thank
love
you.
coming in there. Now, what made you decide to become a doctor?
I had knee surgery when I was very young. When I was about 14, I had my first knee surgery. And up until that point, everybody had told me that, or at least other doctors had told me that I would never walk right again. I would have issues with playing sports. I loved soccer at the time. And there was this one surgeon who told me, don't worry, everything's going to be fine. You're going to be okay. And he operated on me, and 6 months later, I was back on the playing field. And since then, I always was fascinated about the human body, the way it worked, how people can heal, and exactly like you said, the power that made the body is the power that heals the body. We have some remarkable ability to heal ourselves and to just with different supplementations or different treatments, and that's what really kind of sparked my interest in health in general. And going through medical school in England and all over the world, seeing patients get better and patients wanting to get better was really what kind of pushed that passion even further.
And then what made you decide to go into stem cell therapy?
I decided to go into like regenerative medicine in general after I actually hurt my own shoulder. So a few years ago I was, weightlifting in the gym, and I had hurt both of my shoulders, and I ended up getting an MRI on both shoulders and found out that I had torn some cartilage in both shoulders. I had one of them operated on surgically with traditional medicine, and it didn't go well. I still didn't have full range of motion and everything about a year later, and it took me a while to get back to normal. So when I went to do my left shoulder, I decided, you know what, let's look into regenerative therapies, what other alternative medicines are out there. And I had this shoulder done with, human tissue transplant, which is the newer stem cell therapies. And about 6 months later, I was completely healed. Could move the shoulder better than I could move the shoulder that had been operated on a year before, had my full strength back. And after that, it was kind of like, wow, there's something else out there that can really help a lot of people, and I can really help them get better without having to go through very painful surgeries, having a possibility of being addicted to medications afterwards, things like that. So that's what I really wanted to do.
Well, you evidently do it pretty well.
Thank you.
What would you say was the best choice you ever made in your life?
My wife, my spouse, honestly. I think you are the product of the 5 people that you surround yourself with the most. And quite honestly, my wife has been there through thick and thin. We met in residency when I was very, very poor and didn't have anything. And she stuck with me through everything, through moving across states, through moving through countries, through all my studies and everything I've done. She's uprooted herself, and she's really been the one that's encouraged me to push to the next level. So if I didn't have her, quite honestly, I don't think I would have my own business. I don't think I would have the business partners that I do now. I don't think I'd be able to help as many people as I am now. So really a lot of it is because of her.
That's wonderful.
Yeah.
Isn't it great to have a good relationship?
It is,
yeah,
absolutely.
It really is. What do you think is the most important choice that a person can make in life?
There's an old saying that says, I want to make sure I say this right. A healthy man wishes for 1,000 things. A sick man wishes for one thing. And so I think the most important thing that anybody can make about their life, the most important decision, is taking care of their health. And people usually say, well, that seems really selfish, just taking care of your own health and everything. But you have to realize that if you're not healthy, you can't take care of other people.
No, you can't.
You can't provide for your spouse. You can't provide for your children. You can't provide for other people. You can't volunteer. You can't go to work and help with different community aspects of really helping other people out. So you have to take care of yourself first, making sure you're healthy, making sure you're primed and ready to do as much as you can for other people. And I think that's probably the most important decision, whether that is, making sure that you're eating right or working out, things like that. I think that's that's probably the most important decision that I think. And maybe that's just because I'm a doctor, but...
No, but I agree with you. But I think we don't realize how important the health decisions are until we don't have our health.
You're absolutely right. Nobody goes to the doctor until they're sick, for the most part. But that's the great thing about what I do, is that we have a lot of very healthy patients that come in that just want to make themselves better or want to prolong their health and make sure that they're as healthy as they can be for as long as they can be. And that's a great thing about what I do.
Do you think women come to a doctor sooner than men or not?
Absolutely, yes.
You think?
Absolutely. Oh, yeah. Most men would rather die than go to a doctor.
What do you think that is? Do you think they don't want to admit a weakness, or that they haven't taken care of themselves?
I think it's a bunch of different factors. I think historically and traditionally, and this is changing now, males don't want to be seen as weak. They just, suck it up, be a man, go, don't listen to anybody. If you're sick, don't show weakness. That's how it is. That's how it has to be. And that's traditional, and that is starting to change a lot, I feel, on both ends of the spectrum, where females are coming in less and less because they don't want to be seen as weak and everything like that. But I always tell people it's important, to take care of your health. Whether you think it's a weakness or not, a lot of times you're not the expert on your health. If you think that something's wrong, you live in your body every single day.
Yes.
You see the doctor maybe once a year, if you really go often, I would say.
Yeah.
So if you feel like something is off, if you feel like something is wrong, it may be. So I definitely encourage people to go see a doctor and just make sure that there's nothing absolutely wrong.
So do you treat people that go to the doctor just to make sure there's nothing wrong?
Absolutely, yeah. We do concierge care medicine as well. We see patients that have just regular diabetes or hypertension or just want yearly checkups. We do that, absolutely.
Great. That's really, really good to know.
Hmm.
What would you say is your definition of a difficult choice?
I think my definition of a difficult choice is a choice that may be incongruent with my core values. So I have core values in our business, and they're the same core values that I live, every single day. And that's things like always be learning or going the extra mile, not only for patients but for other people, and making sure I'm always being honest and making sure I'm always growing. So I think if you have to make a decision that is against what your morals are or may not be directly in line with a path that you want to take, then a lot of times it's okay to say no. People have a lot of difficulty with saying no.
Oh, they do, don't they?
It's so hard to say no to anybody because people just, for the most part, they want to please each other. They want to be liked. And saying no sometimes is very, very difficult. So making those decisions when you come across them, where even if I could make a ton of money, but I'm in violation of my core values and who I am, it's much healthier to make that decision to say no, because
Yes.
I may have all that money, but my happiness is going to go away, my confidence is going to go away, and those are things that I think are way more important to a person.
Oh, most definitely, most definitely.
Absolutely.
You know, I did a lot of homework before I met you. I'd done a lot of, I didn't mean to make it sound like I just picked you off the Facebook, because I really had studied a lot about stem cell before I made the attempt to go to hear your lecture, and then went and met with you and made the decision. But one of the things I liked about my treatment with you was that no matter when I texted you, you texted me back. And if I left you a message and said, I need a call, please call me, you called me right away. You didn't wait a day or 2 days. You called like within an hour or two as soon as you could. You got back to me. So I always felt really cared for with you.
Well, that's great.
That's why I wanted you on the show, because I fell so in love with you. You're such a good doctor, and you're caring and you're kind, and you made me feel really important. And I think that's, in the healthcare field today, that's very important, because so many doctors and the people in their offices just have no bedside manner, I guess you call it.
Yeah.
Especially the people in the front offices of some of these places. It's almost like somebody trained them to be rude to the patients.
Yeah,
And
it's
that
very true.
doesn't happen at your place.
No, absolutely not.
When I walk in, about 3 people go, "Hi, Judy," and it's like, oh, they know my name. And
Yes.
they know who I am, and
Absolutely.
they care. And
Absolutely.
are you here for your shot? Are you here for, it's nice to have that kind of feeling. Do you do any special training with them? I mean, I know you hire well.
Absolutely. Yeah, so every person goes through a very rigorous hiring process, but then after that, they get trained in how Genesis Lifestyle Medicine works. And they know that the most important people are the patients, period. Any of these people who are rude to patients when they come in, I never understand that, because that patient could just stop showing up one day, and then you're not making any money. And that may seem rude, but in order to run a business, you have to have patients that want to come back and want to tell others.
And you have to make money because you have to pay your staff.
Exactly. And I always tell my employees that whenever any patient comes into our office, they should feel better, or their life should be improved after they saw us. That's whether or not they get our treatments or not, period. Every person that comes in should be better when they walk out the door. When they go home and their wife or their husband or their kids say, "Hey, how was your day?" I want them to say, "Hey, I went to this place, Genesis Lifestyle Medicine. It was amazing." And that's what I tell all my employees, and that's the training that I like to give them, and that's part of our core values, is that going the extra mile for our patients, because our patients are important. Your health is, like I said, and you asked, I think the most important thing in your life, and you're making a huge decision, putting your trust in somebody to take care of you.
Yes.
And to actually tell you what's going to be good for you or bad for you. That's a huge responsibility of a person. as a medical doctor, even more. It's my job to make sure that you're as healthy as you possibly can be for as long as you possibly can be.
Exactly.
So I make sure that not only my patients feel welcome, but my staff knows that, hey, every single patient is a 5-star patient, 100%. No matter if they spend $0 with us or spend thousands of dollars with us over their lifetime, everybody's a VIP. It's the way just to take care of people.
Yes. Well, Dr. Spinoso, I think a lot of people are going to want to know how to contact you. Would you tell them where you are and how to get in touch with you?
Yeah, perfect. Our website is www.genesislifestylemedicine.com, and we have clinics all over the country. We're currently growing exponentially, so we've been really blessed with that. So on there you'll be able to see all our services, you'll be able to email us, talk to us, and everything.
Yes, I know you have offices in Denver and Scottsdale, is it?
Yes, Denver's, right now we have 2 offices in the Vegas area. We have an office in Nashville, Tennessee.
Oh.
We have 3 offices in Denver and Fort Collins, which is north of Denver in Colorado. We are building one out in Dallas and building one out in South Carolina right now.
That's amazing. I'm so very happy for you.
Thank you.
But you know what? You're not going to be able to spread yourself among all those different audiences.
It's true.
I mean, offices, and some people are going to miss out on seeing you personally. But
absolutely. But don't worry. All my staff all the doctors are trained by me. I make sure that all the providers that we have are the very tip top, and we make sure that even the MAs that we hire in different areas or the clinic directors that we hire all live our core values. It's how our company is throughout the country.
Just for me, what is an MA?
A medical assistant.
A medical assistant.
Yes.
Okay.
So the girls that you see that say hi when you come in, those are all MAs, medical assistants.
Oh, okay. So they're not just receptionists. They're trained medical assistants.
Yes. Absolutely.
Well, they're wonderful. I'm always fascinated because, it's so hot in the summer here.
Yeah.
And we come in, and the first thing somebody says is, "Would you like a bottle of water?" And we're like, "Yes."
Absolutely.
I've not had other offices say that.
Nope, we're the only office. Every person that comes in, we make sure that they get a cold bottle of water.
And it's wonderful.
Absolutely.
Well, it's been a pleasure to have you as my guest today, and I know that you've given us a real insight into regenerative medicine. I think a lot of my viewers are going to be thrilled to have heard what you had to say, and I really appreciate you being here today. Thank you.
Thank you so much for having me here. It's really an honor.
Thank you. And thank you for joining us today at Life Choices. We really appreciate you, and we hope you'll come back again soon. Choices. We have choices. They are the source of the success in our lives. When things happen to us, we can choose to believe they happened for a reason. We can discover opportunities in the most difficult experiences if we are willing to look for them. It is what we choose to think about each experience that determines how we respond to it. How we respond determines whether or not we find richer, more purposeful, more joyful lives. We are the only ones who can choose our attitudes and the principles that we live by. Choose well, my friends. Choose well.